My name is Sarah. This is my patient Grace. She has consented to do my neuro assessment, and I saw her walk in, which is one way to assess for cerebellar function. Her gait was even and balanced and coordinated, heel to toe walking. So that was that. Now we're going to go through the 12 cranial nerves. Smell isn't really tested too often unless a patient complains of not being able to. If we did that though, we could use something like an essential oil, and you would occlude one nair at a time and use a different scent in each nose or each nair. The next is optic, and use the Snellen or Rosenbaum cards. I've actually already done that with Grace before for the head and neck assessment. She does wear corrective lenses, and so we've been through that before. Won't go through it again, but that's how we would do that. Then cranial nerves 3, 4, and 6 we can do with the 6 cardinal gazes. I'll use my pen lights, but looking at her, she does not have any she does not have any drooping or anything. Her eyes are symmetrical, and but we'll do this real quick. So just look at me. Look at the other side. And then just follow my finger, please. Go up, over, down, up, over, down. And then I'm going to bring it to your nose, okay? Okay. So she had normal tracking of my finger, no muscles deviated, and her pupils were equal and reactive. Then going back to cranial nerve 5, trigeminal, just take down your mask for a second, show me your teeth, and clench. I'm feeling her jaw, that her muscles are strong, no atrophy noted. Put it back up. Okay. Then I can just take this cotton wisp and go here. Do you feel that? Okay. Feel that? And yeah, feel that. Okay. So that nerve is intact. Let's see. Skipping to 7 is going to be facial. So I've already assessed that a little bit looking at the trigeminal. But go ahead and raise your eyebrows, wrinkle your forehead, squint your eyes. I'm doing it with you. Then take your mask back down and smile, frown, puff your cheeks, and then make your mouth like you're going to whistle. Okay, so it's symmetrical, even on both sides, and so she passes that one. Cranial nerve 8, auditory. There's a couple tests to do. Obviously, she's heard me. She's listened to and followed all of my directions. There's the Weber test, the Rene test, the Whisper test. We've done this before, but so I'll just put her through one since I know her function. But, ma'am, does that lateralize equally? Okay, so that's sensing her bone conduction hearing, and it's intact. Then with the glossopharyngeal, nerve 9, you can do that with 10 as well. And I'm not going to gag her. She has a very sensitive gag, and we've done that before. And but if you want to open your mouth and say ah, her uvula is midline. And then moving on to, we'll just go ahead and do 12. Sorry, once again, take the mask down. Just stick your tongue out, move it side to side, and then stick it like against your cheek. And then she has good resistance to me doing that. And then you can put your mask back up. I think I'm done with that. And then going back to 11, accessory. So I'm going to push against your shoulders, push up against me, okay? And then I'm going to push against your cheek, push towards my hand. Oh, you're strong. All right, good. So she has equal shape, size, symmetry, and so that goes through all the cranial nerves. Moving on to cerebellar function, fine motor. There's a few tests to do for fine motor. Try to angle this down. One of them is we're looking for fine motor, so rapid. So she could just take her hands and on your knees, just kind of pat them up and down quickly, okay? Also, this one's easy to see on the camera. Close your eyes and hold your hands, arms out, sorry. Hold your arms out, close your eyes, and then touch your finger to your nose, kind of quickly each side. There you go. A little faster if you can. All right, perfect. Okay, and then you don't have to do this one, but go ahead and, well, you could just have your foot and rub it down the other shin, your heel, the other shin, but anyways, take a time. Go ahead and stand up. We're going to do the Romberg's test. This assesses your balance, and so stand with your hands just like that, and then you're not swaying, you're stable. Close your eyes, and then again, we're looking to see that she remains stable with no significant swaying, so she's good with that. All right, go ahead, sit back down. We already talked about her walk. We could have her do some steps on just her heels, other steps just on her toes, but she does have good stability when walking. Moving on to sensory, we will do a couple places where I'm just go ahead and close your eyes and tell me if you feel sharp or dull, okay?
Mm-hmm. Sharp. Dull.
Okay.
Sharp. Dull.
Okay.
Sharp. Dull.
Okay, so I hit about 6 places on her, and she was able to correctly identify if it was sharp or dull. Also can use tuning fork over different joints. And for the sake of time, I'm just going to do one, but she should feel vibration, which she says she does. Then I'm going to, let's see, close your eyes. Every girl should know what this is. Close your eyes. I'm going to put this in your hand. Tell me what it is.
Oh, this is lip gloss.
Yes. All right, now hold up both of your hands. I'm going to write a letter. Tell me what it is.
S.
And tell me what that is. Number
4.
It's a number. Okay, perfect. And then then we'll go on to talking about reflexes. There's superficial and there's deep tendon. Superficial reflexes, it'd be easier to do this on an exam table. But she could lay down and then taking the, there we go. Anyways, well, I need it. Here, put it away. Taking this part of the hammer, could take it and stroke from the downward towards the umbilicus and looking for movement. That would be positive finding or normal finding. Then also a plantar reflex, taking towards the heel, from the heel towards the toes, looking for the toes display some. That would be also a normal finding. Then deep tendon reflexes, there's the biceps, the brachioradialis, triceps, patellar, and Achilles. We went through all of those prior to this video. She has a very good patellar reflex. When you go through doing those, you would assess each of those left and right, one after the other. For the sake of this video, I'm going to see if I can just get her. Here, dangle your knee. Relax. You always want them to relax their extremity. We'll just do that one because that's going to elicit the best response. The Achilles, you look for, you'd have them dorsiflex and you look for them to push down on your hand. Biceps, you'll see a contraction, flexion here, and the triceps is hard to elicit, as is the brachioradialis. So that about wraps up this neuro assessment. Thank you, Grace.